We're really happy and delighted to have Dr. Priscilla Chan with us today. Uh, she was born in Braintree, grew up in Quincy, suburb of Boston. First generation American who grew up speaking Cantonese and served as an interpreter for her grandparents. She entered Harvard University. During her time there, she participated in the Franklin After School Enrichment Program. I mention that because you'll see education is a really important part of Priscilla's life. After graduating with a bachelor's in biology from Harvard, and she was the first to graduate college in her family, she taught at the Harvard School in the Bay Area, then went to medical school at UCSF, where she finished her pediatrics training at the same institution there at UCSF. In 2016, she co-founded the Primary School, a nonprofit organization, again, an educational theme here that would provide K through 12 education as well as perinatal care in the Bay Area. And in 2015, Priscilla and her husband, Mark Zuckerberg, founded the Chan Zuckerberg Initiative. Dr. Chan handles the day-to-day operations of that initiative. It's a huge, impactful initiative. And it's a large philanthropic enterprise with an aspiration to help solve many of society's toughest challenges, from eradicating disease to improving education. Priscilla was nominated for the San Francisco Chronicle's Visionary of the Year in 2017, honoring leaders who strive to make the world a better place and also drive change by employing new, innovative business practices. So, Priscilla, thank you for joining us. We're really happy to have you here. One of the things that I've heard that you've said is that your own background as a child of immigrant refugees and experience as a teacher and as a pediatrician for vulnerable children influences how you think about the initiative and how you think about the philanthropic work in science, education, immigration reform, housing, criminal areas, criminal justice, and other issues. So would you talk a little bit about that link of your own formation and how that affects the initiative?
Yeah, I'd be happy to. Thank you for having me. It's a pleasure to spend time with everyone here. I think that my family story, even before I'm born, is probably, to me, the most important part of my story and the reason why I do the work that I do. And to be clear, I'd be doing a version of this no matter what, because of my family and because of how lucky we've been. My parents, my grandparents, came to this country as boat people during the Vietnam War as refugees. That means that my grandparents put my mom and put my dad, they were teenagers at the time, on a boat off the shores of Saigon with a belief that there had to be a better future somewhere else. And it happened. It took a decade for them to reunite, but my mom ended up in New York and my dad ended up in Boston, and they started building a new life in the United States. And how incredible is it that it all worked out? I had amazing mentors in my schooling. I had people who looked out for me, great public schools, and I ended up as a student at Harvard a freshman year with opportunities that I had never known even existed. I was going to an idea. When I got there to the reality, my mind was blown. I was like, how did this happen? There is a whole nother world I don't even know about. And I felt so overwhelmed with all sorts of emotions, but a large one being gratitude that I had to give back. I had to unlock what was made possible for me for other children. And so I've tried all different seats, Jim. I've been an after-school teacher in a low-income housing project. I've been a school teacher. I've been a primary care pediatrician in San Francisco Safety Net Hospital. And I have to say that I don't know if I've been able to lift up others the way I've been so fortunate to be lifted up by others, because it's hard. I love being on the front lines. I love being with kids and families, but I have to say that the systems that we work in make it really hard to actually have that impact. And so, in 2015, when I founded the Chan Zuckerberg Initiative with Mark, it really was, from my perspective, how do we make the systems work better? How do we give frontline practitioners better tools? And from Mark's perspective of, I've built great tools for consumers for many years now. How do we bring that to actually make a difference for those doing some of the most important work in the world? And so those are the lenses that we brought to really hopefully build and continue to bring to the DNA of our organization.
Well, thank you. Let me just mention to our folks listening that after 20 minutes or so, we'll have a Q&A session with Priscilla. So anything that occurs to you can go in the chat, and we'll draw down the chat then. As someone in control of the day-to-day operations of something this size, I can imagine there are things that you knew before the pandemic in 2020, end of 2019, that you were unaware of in 2015. There must have been, a learning element to the initiative as well. And I get to the pandemic later. Can you say something about that and how that went?
The transition from being a primary care doctor to leading this organization. Is this therapy hour? Do we have anyone who can help me here? You guys have, you guys are all amazing physician leaders, and how do I think at the beginning, I was like, okay, I was just a resident. I have a practice, but now I have to build an organization. And I was convinced for a long time that I needed to have gone to business school, or there needs to have been like a paper, a book, a reference that I could look at that would tell me what to do. And I think that turns out I don't think there is. If there is, someone send me a link, I'll go read it. But what I have been able to harness is actually that learner mode of being a student, and the combination of, asking others, learning from others, but also trusting your gut when, as a leader, oftentimes the questions that you have to deal with are the ones that don't have a clear answer. And we deal with that in medicine. There are trade-offs, and you have to make the best choice possible, and realizing that there are connections, that my training as a physician and being able to look at data, look at imperfect data and make a decision is something I do every day, and that it is not isolated from what I learned to do over the past decade. And being able to support the growth of others, being able to have empathy for what others are doing is part of my job every day.
The initiative has been described here as one of the most well-funded philanthropies in human history. And yet, when you think of and I know you have, interests in other areas outside of biomedicine, healthcare, equity as well. But just in the healthcare area, it's a $4 trillion yearly ecosystem. How do you pick and choose strategically for impact, given this vast system that you have to participate in?
Yeah, our work in science is 5 years old. And if I put on my pediatrician hat, that's a kindergartner. We've just made it to, we're solidly potty trained, and we are learning about how to operate well in the outside world. And I bring that up a lot, and I bring up the fact that the world that we work in is an enormous ecosystem, and we are a tiny, tiny fraction of that. So when we say our goal is to cure, prevent, and manage all disease by the end of the century, we are 100% not doing this alone. We simply have faith that if the ecosystem works together, and if we do our part as well as many, many others, we have a chance of doing that. In the new hire orientation, I talk about this exact topic and how it is possible if we work together. Penicillin is not that old of a drug. And if you look at look at our two most recent comparisons in infectious disease, SARS-1 took more than a year to characterize and understand. Within weeks, we had a pretty emerging and helpful understanding of COVID-19. The pace of science communication, the pace of sharing knowledge has accelerated tremendously, and that helps everyone. But back to your question of, given this enormous ecosystem, how do we choose what we work on? I think it goes back to what can we uniquely do, and what can we uniquely contribute to the space. And we have an amazing multidisciplinary team of scientists, computational biologists, data scientists, engineers, product designers, policy folks, user experience experts, and they have a unique skill set to be able to understand a problem and build software to actually scale so that many can use what is the gold standard in tooling in a space. And I'll go back to COVID-19 since it's always on all of our minds. We had built a tool prior to the pandemic that was called ID-Seq, where we were able to take the outputs of a sequencer of any sample, basically, and what the software would do is take out all the human DNA and then identify what's left and match it against the known library of infectious diseases. And we were able to help scientists and health practitioners identify hypothesis-free what infectious agent might be in a sample. That was amazing, and we were excited about what it was able to do for unknown illnesses, especially in third world countries, developing countries. And what we were surprised by was when COVID-19 happened, that the software was immediately able to identify cases of COVID-19. And in fact, I identified one of the first cases in Cambodia, one of our partner sites. And what then we realized is, oh my gosh, we need to think differently about who we're trying to serve in this moment. And we sent our scientists, we sent our user experience experts, we sent our wet lab trainers to departments of public health to try to meet their needs. A different set of practitioners who needed to be able to do metagenomic sequencing of COVID-19 to understand the variants that were coming into their community. We made that shift quickly, nimbly, and we by no means were the public health system, but we were able to fill in a gap to be able to empower those practitioners to do their best work quickly. So it's about really understanding where our differentiated superpowers are and who actually can complement those abilities to do the best work together.
When you think about work that's going on at the BioHub with the Bay Area University, Stanford, Berkeley, UCSF, where do you see filling the gaps that exist in harnessing that work?
Yeah, so the BioHub is an independent organization that attracts folks from Berkeley, Stanford, UCSF to come together and actually collaborate on problems together. And what we realized talking to a lot of scientists early on is that there's a huge incentive for in academia to be the first to characterize something, to be the first to sequence something. But actually, as medical practitioners, that's great. You did it once. I need like the full set of information. And one example of that is our single cell sequencing work. It is academia has rewarded the first to do a lot of this mRNA sequencing to characterize what different cell types are behaving like, but there isn't actually a effort to or infrastructure to actually sequence the entire human body. And like when we come together from all these universities on top of the technical infrastructure, the different tools, sequencers that we have at the BioHub, we were able to do this really quickly and effectively because we had we had the connections to physicians, to patients, to the tools, and to be able to say, regardless of what the current academic structure rewards, we believe that this is important. And there was both enthusiasm, collaboration, and support to make it happen. And we're so proud of the BioHub. They were able to put together one of the first drafts, if you will, of the Human Cell Atlas, which is super exciting.
When we were speaking earlier and talking about the AMA's own strategic framework, we made the point that, one of the accelerators, the newest accelerator in our framework has to do with health equity. And I know you have an interest in community-based work as well as equity. Could you talk a little bit about that?
Yeah, I'd love to. For us, and it sounds like you guys look at it very similarly, we cannot achieve our mission and vision of actually cure, prevent, and manage disease for everyone if we don't take health equity into consideration. And so it is an imperative for us to acknowledge and take into account the inequities that are currently in our systems to be able to serve everyone. One example is we know that those who participate as patients in research participants in basic science and the samples, the cell lines that we have, white men are middle-aged white men are overrepresented. And so, it's a generalization, but largely true that our basic science research overrepresents Caucasian men of European descent or folks of European descent in general. And that leaves out a lot of people who are not represented in our scientific understanding of the human body. And so we look at how do we bring in a diverse, more complete picture through looking at different ancestries. We just launched an RFA looking at bringing in different data sets from folks of all different ancestries that are traditionally underrepresented. We also look at age. I might be a little biased because I'm a pediatrician, but development happens. And we cannot simply extrapolate that children are little people, nor is an infant, the same as a teenager. And so how do we actually understand the course of development across different age groups, across the span of a human life to actually enable us to understand and better serve folks from all different ages and backgrounds?
We when we started our own work in this area, there was a strong argument made that took us down the pathway of thinking about our diversity and inclusion internally first, and we heard the same from Robert Wood Johnson yesterday. How are you thinking about that?
It's enormously important to us because we believe that we need to be able to having an organization that is diverse and retaining an organization that is diverse by focusing on equity and inclusion is important for us to meet our North Star, because if we don't have a diverse organization, we naturally have incredible blind spots that don't allow us to actually do the work that we want to do. And we've focused on this since day one of our organization. We are an organization that is majority women. We have folks from all different professional backgrounds. And I think roughly a third of our organization is from underrepresented backgrounds. It's something we're really proud of. We've worked hard at, and there's a lot more work to do. And in terms of how do we actually build, so we have a diverse group, and we need to do work to continue to maintain that. But now comes the hard work. The research says that, if you want to solve a simple problem, actually a pretty a monoculture works well for simple problems. But you actually, the place where you can unlock the benefits of a diverse team is actually when you're trying to solve hard problems, which I would say that we're all trying to do. And that's where getting us to actually listen to each other, have shared vocabulary. Even when I said user experience to bench scientists, they don't share vocabulary. So building that team and getting them to actually speak hear each other. We don't need everyone to speak the same language. In and of itself is a whole endeavor. And then we need to then work creatively together. So I would say that's where we're at. How do we actually, I think sometimes we do it well and sometimes we don't, but how do we unlock the power of these enormously diverse teams of different lived experiences and different professional assets?
Priscilla, you've been just more than generous with your time, and it's been really delightful and interesting and fascinating to hear about your work. And you'll not be surprised that we're also delighted to know that there is a physician behind the wheel at the initiative in a day-to-day way. So thanks so much for doing this and taking time and joining the senior management team here at the American Medical Association.
And thank you for everything that you guys do. You touch an enormous number of lives. So I deeply appreciate it. And I get your emails too.
Okay. Thanks very much.